Hi, my name is Jasmine. I'm a student nurse and I'm going to be teaching you how to apply restraints. So the first thing I would do is I would introduce myself to the patient. Hi, my name is Jasmine. I'm a student nurse today. I'm going to be applying a restraint as the order says on the MAR. I'm going to go ahead and check my patient identifiers, first, last name, date of birth. Then I am going to explain to the patient what a restraint is, why it's necessary. Of course, I would double check with the MAR to make sure that there is an order for a restraint. Then I would perform hand hygiene, gather my supplies. Usually what we need is a restraint that goes against the wrist or the legs, ankles I mean, and then we'll need the other restraint part that attaches to the bed frame or the chair, whatever is indicated. Then I would go ahead and don some gloves if necessary. I would set the bed at the lowest setting. Usually if you set it really high and then you put it low when you leave, there's a lot of wiggle room for the patient to be able to kind of move around, and that isn't necessarily safe. So putting it at the lowest setting doesn't give them a lot of wiggle room. So that's what you want when you're placing a restraint. So to place a restraint, you're going to need the part that attaches to an immovable part of the bed. If you do it on something that moves, like the railing on the bed, it can be dangerous for the patient, and then they can either get out of those restraints or get hurt. So an immovable part of the bed would be like a bed frame or a chair arm or something like that. So to demonstrate, I'm going to go ahead and grab this long piece of fabric. I'm going to go ahead and make sure that the edges are even. Okay, so first I'm going to grab the end towards me, and then the end towards the outside, I'm going to make a loop like this. Okay, now I'm going to go over and under, and then I'm going to tighten. Okay, so if I pull, the patient's pulling on the restraint, there's not much to pull. The reason and then it slides because my material is satin, but the reason it's called a quick release is in the case where you need to release the patient out of the restraint, you just pull the short edge and it releases them from the restraint. While they are in the restraint, you're going to want to at least check every 2 hours or check the policy that the hospital that you're working at has. You're going to make sure that you can at least fit a finger or two under the restraint. You don't want to occlude any blood flow to their feet, their ankles, or to their wrist or their fingers. By doing this, when you check every 2 hours, you're going to check their capillary refill, their sensation, skin temperature, anything that's necessary with tissue integrity. If they have an IV, you might want to maybe see if there's another restraint that you can place and then do the restraint somewhere else. You don't want to occlude an IV because that would stop the IV from working. Kind of follow any necessary protocol or anything that's indicated per hospital policy. Like I said, every 2 hours, when you document, you're going to want to document when you place the restraints, who placed the restraints, how the patient tolerated the procedure, what type of restraints, and then lower the bed at the lowest position to keep your patient safe. Leave your call light close to the patient in case they need anything. Perform hand hygiene again before you leave. And that's about it. That's how you perform a restraint.